Welcome everybody to the August meeting of the Commission on Aging. Well, I'd like to call the meeting to order. And our first order of business is to approve the July minutes that Jill has sent the draft to everybody. Are there any additions or corrections to the minutes? If not, do I hear a motion for approval?
I move to approve. I'll second.
Okay, all in favor?
Aye.
Opposed? Okay, minutes are approved. Today we're going to have our social workers, Amy Jordan and Katie Bokuki.
Very good.
All right, give us a presentation on the case management program. So, ladies.
So I'm going to start it off quickly. So right around this time of year, we start to do the budget process for Dane County, and we get money for case management as well as nutrition. And so I just briefly wanted to give you this report that the Area Agency on Aging developed a few years back, I think 2019, just to get a quick overview of, what do we get from Dane County, what's kind of involved. And so this is their case management program. There's all the focal points in Dane County, which are other senior centers, and then Newbridge, Madison, all have case managers or social workers. At our senior center, Katie's a case manager because she doesn't have a social work degree, but plenty of great experience. And then Amy's a social worker, and Sarah is a social worker. And so this program, as I talked about before, is very unique to Dane County because it's only in Dane County that you have social workers or case managers at the local level. Once you move out of Dane County, you go to the ADRC, which is only short-term case management, but here these guys are long-term, forever and ever. We fall under the umbrella of the Area Agency on Aging, which is under Dane County's Department of Human Services. So that's what we're doing now is we're creating a budget request to go to Dane County Department of Human Services. So we'll go to some budget hearings and ask for money. You can see case managers, they all have to follow certain standards and go to trainings. So everybody kind of is serving people in the same way. There's our locations, as I spoke about. No matter where you go outside of Fitchburg, most communities have a senior center. Newbridge, Madison covers all of Madison, so they operate out of a lot of different locations like Warner Park, the Goodman Center. They have nutrition sites in various smaller locations, and then the Madison Senior Center as well. But otherwise, we're all just kind of our own little communities. And different too, Sun Prairie is their own 501c3. They're not part of the city. Black Earth's the same way, so their funding is a little bit different. They do a lot of fundraising. They get money from towns, where here it's just the city of Fitchburg and Dane County. So that was I talking about Newbridge, Madison. They used to be 4 coalitions in Madison, and just to streamline and make it more efficient, they merged all 4 of those coalitions that served Madison and created an organization called Newbridge. So now they are one with one HR person and one executive director. It's just a little bit more cost effective. As we talked about, these are all the focal points in Dane County that receive funding for nutrition and case management. Who can use the program? So this is where it gets a little bit interesting. For reporting purposes for the county, we have to provide service for 60 and older, and people must fall below 240% of the federal poverty level. So I think maybe you guys, it's 30,000 maybe for a single, something like that. So anybody above that income level, below that age that we serve, we don't get to send those numbers to Dane County because we are only funded to serve folks within this parameter. And so our program serves a lot of other people as well. We don't discriminate, doesn't matter what your income is. We've served people as young as 50. Oh, go ahead, Bill.
I'm sorry.
That's all right.
I'm just curious, is the 30,000, is that 240% or is
Yeah.
that the poverty level?
That's 240%. Poverty level's way lower. Yeah. Exceptions, that's what I was talking about. We will fund people that are younger, but again, we don't get to send those numbers to Dane County, but we do report them to the city because obviously they're important people and we serve them. And these guys will talk a little bit about their role, but really it's the main purpose of the case management program is to keep people at home for as long as possible and provide affordable services, things like housing, transportation, meals, other assistance. And then when the time comes and they no longer can remain at home safely, these guys facilitate, services to move them to a different location if that is the case. And today you'll find out how complicated some of the cases are, and it's not what we used to see in Fitchburg or throughout Dane County, the complexity of the people that we're serving, but it is now the norm, and it takes a lot of time, and these guys do a great job. So, again, their role in developing trust and continuing to put services in place and maintaining that relationship with that client or that client's family, and they can, again, go into further details when they talk about the cases. The referrals come from anywhere and everywhere, as you see, friends and neighbors. The ADRC, which there is one in Dane County that does the short-term case management, they might refer. We get lots of referrals from APS, Adult Protective Services, because they're not able to assist the client for various reasons. Hospitals, local clinics, family, friends, as I said, so they can come from anyone. Even people, a lot of families from out of town too will reach out as their parents are here alone, and they came upon us and reached out to talk to somebody for help for their parents. So lots of forms, as you can imagine, when you get any sort of government funding. There's a lot of standards that we have to maintain. There's a lot of reporting and tracking. So that is what this paragraph talks about, functional assessments and client intakes and so on. And then based on what they see after meeting with the client, they develop a service plan to say, here's our goal. Maybe they get meals 3 times a week. The goal is to, up their nutrition, make sure they're getting a healthy meal. Maybe it's socialization, so their goal is to get them to the senior center 3 times a week. It can be a variety of things, and then, that's discussed with that client. INA is information and assistance, and that is just a really short term. I'm just helping somebody for the short term. It could be just a Medicare D plan. It could be just here's some housing information because somebody wants to move and they just don't have that information. So it doesn't involve a lot of, a ton of time and complexity. It's just kind of simple services and referrals. This is all the stuff that is involved in case management, as we talked about, intake and assessment, service goals, and then monitoring those goals, and then the ADRC INA. Again, we provide information and assistance. The ADRC can as well. The funding. So Dane County funds this. It's non-mandated. It doesn't get funding from like Older Americans Act or any sort of federal funding. And so it's a unique situation where you see a lot of partnerships with the local municipalities or towns where they have to raise a lot of money to maintain the case management program too. So therein lies the work behind the advocacy to always ask for more money. And I serve on the legislative board, the Dane County Area Agency on Aging Legislative. So we just put forward our request, and it was about, I would say, $250,000 to help fund the services throughout Dane County for case management. And in the past, what they do, it's a little different this year how we did it, but in the past, sometimes it's just a cost to continue. It's not a ton. Sometimes we have more of a need or we just do stronger advocacy. But whatever they decide, the county, Dane County, they plop into a formula that each of us as focal points have a little slot, and that formula is comprised of things like ethnicity. It's a different rating, how much percentage in that formula you get. So, if you have a higher population of low-income older adults, if you have more diversity, if you're considered rural, they look at people that are on food share. And so based on those formulas, you might get more or less. So depending on the population you serve, there's a figure for 85 plus, there's a figure for 60, to 75 or something like that. So the Area Agency on Aging Access Committee is what houses that formula, looks at that formula, and they'll probably be looking at that really close for 2025.
Does the caseload factor into that? In other words,
The
how many
census
you're serving?
data, yeah, and the census data too. So we've continued, yes, as we see more cases, we've gotten more money over the years for sure. And then the Medicaid part, when they serve anyone on medical assistance, it's kind of a little bit of a different slot because they actually bill for that service. So Dane County allows us, I think, when I started, we were allotted $3,000 for MA, that's all. And that's about what we were billing. And right now, I think we're close to 17,000. And so they track their hours, and that's a whole different reporting system that goes into the county. And that is federal funds, obviously. What we have to be careful of and what kind of works against us is there can only be one MA billing provider. So say somebody is on family care, which is a medical assistance support program, funded by the federal government. They're their primary service provider, even if that client is coming to us for lunch every day, in our office every day, asking for help with their cell phone every day, and just a whole bunch of other things. We can't bill for any of that time. Even when things are going wrong and finally, we will never let anyone suffer. We will always serve them. And so there are many, many times that we are not able to bill for a service that we provide, when other service providers aren't meeting our standards, which are very high. This gives you a little bit of an indication. Again, the latest figures is 2019. I think it's just a little bit over $1 million now that the county does provide. And it sounds like a lot of money, but when we look at the number of case managers, in Newbridge alone, what is there, 30?
Mm-hmm.
It's an expensive program, but it's also a very cost savings preventative program too. So we're constantly trying to educate the county board supervisors about there is no better value than this kind of program, So again, we'll see what comes this year. It's always a process. Here's service hours and clients throughout Dane County. Stats only go to 2018. Service hours we have to report and clients. And again, keeping in mind, this is 240% below poverty. This is not everybody. This is not all older adults in Dane County. The county then will send out random surveys to clients to try to gauge satisfaction. And, it's interesting, there's a lot of older adults that don't know they have a social worker or a case manager. It's just somebody that helps them. And, and maybe that's okay because sometimes people don't want a social worker. They don't want to be in a system. They just like that somebody is helping them. So that is really it. I just wanted to go through that quickly to give you that background. And then I'm happy to have Amy and Katie. Sarah's on vacation, but I have a few notes from her. And I just thought it was important for them to just share some of the complex cases that are more of the norm versus, the unique cases anymore. So whomever wants to start.
Hi. So since I started here 19 years ago in September, things have changed a lot. I feel the cases have become more complex with a lot of the dominant themes today being housing, mental health, and transportation. Trying to navigate around the city and having enough money to do that with families that are really dysfunctional right now. So yeah, they take up a lot of our time. One case that I'm working on right now is an 84-year-old woman living on a pretty large property, and she's somebody that I've known for many years, and right now she has a lot of mental health issues. There are lots of animals on the premises, 50 plus cats, dogs, dead cats, animal excrement. She had no plumbing for 4 days, no water. So trying to work with police, fire, building inspection, it's been really challenging. Dane County Public Health refers it back to our municipality because we have building inspectors and we have animal control. Even with that, it's been difficult. She remains in the home. You can barely walk in. APS has also been involved, Adult Protective Services, but she still is her own person. So Wisconsin says if you have capacity, you can live however you choose. Whether it's with 1 million animals, you know, a house full of boxes and clothes and food. Now, of course, I'm a little bit jaded because I know her really well and all these other entities do not. So I've seen a decline in trying to get her in to see the physician to say that no, living with dead animals in your house is not okay. That is not good decision making. Maybe there is something else going on. So that has really consumed a lot of my time, trying to involve all the other agencies and departments within the city, trying to have a safe outcome for this person and a healthy outcome. So that is just one. There are lots of people having hoarding issues in Fitchburg. I have another couple that also has a hoarding issue going on, but they are also willing to get it cleaned up. So typically for just like a 3-bedroom home, I'm talking maybe 1,200 square feet to clean up this one area is about $4,500. So thank goodness this couple has the money to do that. Otherwise, there is no money to help with that currently. We do have hoarding funds available through the county. However, those are really limited. And you have to apply for them right away. It involves going out doing an assessment, taking photos, finding the company that will do that, them providing the estimate, Dane County approving it, and then setting up the times to do it. For another woman that I have that hasn't had the cleanup yet, we've been working on this since February because she sets it up, she cancels, sets it up, cancels. And finally, Dane County said, if you don't set this up, we're going to revoke the money and give it to somebody else. But this is really common, a common theme. And then just the mental health piece of it, working with somebody that has mental health issues while still being kind and compassionate with their needs is also challenging. But I think the goal is always to provide a safe and healthy environment for people so they can stay at home. But that's not always the case. So somebody like myself and Katie and Sarah, we're there to come in to have those hard conversations with families and with the clients themselves about maybe transitioning to the next living situation, which I just had to do yesterday. It's hard watching people suffer inside their home, yet maintaining that pride of wanting to be there, but knowing it's not safe anymore. Somebody has to have that conversation. It might as well be me. So, yeah, but I love my job here, and I love serving this community. I live in this community. So yeah, it's a great place to be and to serve.
Okay, Katie.
So I'll just give you a couple examples of some people that I'm working with right now. One is one of these more longer term clients. It's a lot of relationship building. He's a 71-year-old gentleman. He's agoraphobic. He's afraid to leave the house. Extremely scared and limited in what he's able to do. His brother out in California referred him to me, was just Googling numbers about Fitchburg and seniors and came across, and I answered the phone. So he doesn't have any informal supports at all. He has a lot of medical issues going on because he doesn't get to the doctor very often, even things as easy as like getting a haircut or doing banking are very challenging for him. He doesn't have internet. He needs help. Now that there's not phone books, he can't look up how to order takeout, so he needs help with that. So I've been able to build a relationship through many visits and many phone calls, being able to get in the house and have him trust me to be able to help him with things like energy assistance, getting him a fall button, because he had been in and out of the hospital due to falls, getting him a stable walker so he can actually get around his house, getting him a phone that works, helping him with his bills. He's very limited income. So one of our biggest things is I've been able to get him to accept having a caregiver come into the home. So he gets showers on a regular basis, and it had been decades. So they're baby steps, but they're huge, and he is so happy, and even though it's just me and a caregiver and maybe one other person, he gets 3 more people to talk to during the day. So while maybe I'm not doing something specific, even talking on the phone to him is a huge deal. He was able to have a hot meal on Thanksgiving for the first time in 14 years when we were able to deliver a hot meal to him. He's afraid to use the microwave. So even when we had meals, he wouldn't heat them up. So he was ecstatic about having a full Thanksgiving dinner. So, and I think that was the friends that donated those meals. So he's one of my more long-term ones. I have another one, just a couple weeks ago, she moved to Fitchburg. She's 67, had a lot of health issues, got evicted from her home. Turns out those health issues, she wasn't able to walk, things were going wonky, she couldn't work anymore. So she lost her apartment, turns out she had lupus. So she's starting to get that on track. But lost her job and lost every single possession she had that was in her apartment.
Because of the eviction.
Because of the eviction, it all
They
went
just
into a
throw it all out.
dumpster,
Yeah.
so she had a suitcase.
Throw it all out.
So she was in a Salvation Army for 14 months, trying to find an affordable place to live. Recently moved into one of the senior buildings here in Fitchburg. And obviously she has a lot of depression based on her situation. She was a very outgoing and social person before. She can't drive anymore because of her diagnosis. Has difficulty walking even within her apartment. But we have found that she's going to be coming to the senior center next week. We have volunteers who will be giving her a ride. A lot of the programming here really line up with her interests. So she's very excited to hear about some of the programs going on that she can sign up for. So she's excited to come to lunch and start meeting people. She's young and spry and wants to socialize and make friends again and slowly build up. She loves sewing and build up her craft and her hobbies and supplies again. So we're excited we finally were able to get volunteer drivers. So she's very close, but that was a big hindrance, is the transportation to get her to the programs that aren't lunch. But I think we found a solution, and so we're excited that she'll be joining and doing some social outlets and hopefully helping with her mental health. So.
Well, I think those cases are just really clear examples of the above and beyond that we do. Like, these people could live at home with nothing and be miserable and, end up just with no quality of life, and that happens very often. But I think that, having this at this level, the opportunity to be kind and give people quality of life in these later years is just, that's what our society needs to do. And I understand how funders, it's hard to fund something like that sometimes, well, they're making their own choices, but that's just not what this program is supposed to be. So those are really good examples of, that man, he went for a long time without showering, and he could probably go for a lot longer without showering. But, his quality of life is terrible. And this woman that's living in these conditions, hopefully there will be a good end result here, because of Amy's hard work and passion for making sure that she does have some quality of life in the end. So Sarah's got a couple here. 80-year-old woman with dementia, no family at all, never married, no children, lives alone in a condo, had a couple cats that passed, still thinks one of them's there, worked closely with a friend, and the friend became her healthcare power of attorney, who is now trying to put services, or help her with the transportation and medical appointments and scheduling, that kind of stuff. Take her to get haircuts. There was a referral to Adult Protective Services because the woman was putting her feces down the sink, and these are just things that people with dementia, their minds work. And this is another example of APS saying, we can't pick this case up because she's their own person. And so then trying to get this woman to the doctor to get a diagnosis or to get guardianship, it just is so time consuming and sometimes really frustrating. Adult Protective Services has state statutes that they have to follow, which say if they're their own person, we can't help.
And if somebody isn't their own person, the process, APS does not even help them. I petitioned for guardianship for 2 people last year.
Yeah.
It involves a whole bunch of paperwork, communication with the doctor. It's like literally I'm filing. I'm being subpoenaed to testify against my own client.
Right.
It's really hard.
Yeah.
They don't help in many situations.
They're really I mean, they help all ages too, and the majority of their service does go to people under 60. I think financial fraud, that is something that they oftentimes will pick up very quickly. But these really complicated cases, and this is what we're trying to educate Dane County, because I wouldn't be saying this 10, 15 years ago. It wasn't quite like this. But it doesn't matter what area you go to, Oregon, Mount Horeb, they're all experiencing this, which is why it's so important that Dane County Board of Supervisors are educated on what's going on. And so with this year's request, we actually did a whole bunch of stories just like this to say, I don't think you understand what this case management program really does.
Jill, I'm sorry. If I just had a question. Why is it getting worse? If you're describing a generalized broader worsening of the situation, is that because there's just more older people around? Is it just the aging of the
I
population?
think just a breakdown of the family and society in general. I think people are not getting mental health treatment and care from their doctors, not a lot of money, and I think COVID really exacerbated all of that because people didn't go to the doctor, and then there was the big staffing shortage after COVID. So even if you need help, I had a client wait 5 months to get help in their home from family care, and that is something that the government pays for. 5 months. It's unreal. And you can't go anywhere. If I have a client go into a nursing home and they want to go somewhere or go into the hospital and they need rehab, they're putting people all the way in Jefferson.
Yeah,
Watertown, Evansville, so far away from their family, there's just nowhere to go.
It's an interesting article in the Madison magazine. Did you see that?
No.
In the most, you'll want to find a copy. I'm certain it's available online, or I might still have it. But they had a multi-page piece on the lack of caregivers. There may be pockets of funding, but there's nobody to fill those
We used
needs.
to have a long list of private caregivers. There's one person on that list now, and nobody else I would even remotely consider hiring.
So as I read that, I wondered, is that a
crisis.
and something that might be future programming to provide volunteers for temporary respite for those caregivers, or something to augment?
Right.
Is there another way to serve our population?
It's really, it's being talked a lot about in the Wisconsin Legislative Committee that I sit on too, and what a crisis this is, and a lot of state requests going in to the Medicaid reimbursement rates. There's no caregivers because you don't get paid anything. I mean, that's the bottom line. And that doesn't seem to resonate with policymakers. The last big push to get more funding for CNAs, the result was no, there's not enough CNAs because the training hours are too extensive, because Wisconsin's required training hours were more than the federal government's. And so the legislators decided that that's why there weren't enough CNAs, so they reduced the training hours rather than increase the pay. It's really about the pay, and it's a hard job, and it's one of the most important jobs besides teachers to me, and the social workers.
How many cases do you have at a time?
I mean, I don't,
It ebbs and flows.
yeah, I would say I've got about 50 people on my caseload, but am I actively seeing them every day? No, but there's people I do talk with every day.
Oh,
Mhm.
yeah.
And there's always new people coming in.
Always.
We take kind of round robin with the new people. Not mine, yours. Oh, I'm so glad that one's not mine.
So you could use more case managers, more social workers.
I put in, I mean, you know, our next attempt
Because you
will
did
be
increase it at one
Yeah.
point.
a bilingual
Yeah.
case manager. And I think we're okay for 2024. I put that in, we had to put a 5-year plan that I can talk about. I put that in for 2025. And we'll also wait to see what happens with Sarah's position. You know, she's doing, you know, half at the police and half here. And so if she were indeed gonna go full-time at the police, if that did happen, then I would get to keep that 20-hour position and then tack on a new request for 20 to make it a full-time. So we'd have 3 full-time case managers. Well, you know, and I wanted to, you know, we don't really have a wait list per se. These guys are busy, but these apartments, you know, as we continue with the outreach and they develop more connections and establish really good relationships with apartment managers, you know, Amy, you know, Chapel Valley and McKee, she's been in those apartments forever. And, you know, they're like, Amy. And that's what's gonna start to happen with Limerick and the High Line and now Novation Commons. And so that's when we're really gonna see that need increase. And those are affordable apartments too. And, you know, sometimes with that, people don't have as many options and cases can be more complicated. And again, I think the family structure, a lot of people that don't have family. It's just the nature of the world we live in now. So it's been really interesting to see the transition and watch the program change and try to fight for funding for such a basic quality of life need that every older adult really deserves, no matter what income they have. So
We had a pretty big homeless population move in that the county was serving. They called it hotels to housing. So a lot of those people were in Fitchburg. So that took up a lot of our time this past couple of years because the goal was to get those people working again. Seniors that are like, you know, that
have mental health,
have
that
mental
are
health issues, they can't physically
have
work.
no
and they want-
transportation.
Here, we'll pay for your housing for 2 years and then we want you to be totally self-sufficient. Well, do you think that worked? No, maybe for a couple it did, but
Yeah.
I just recently had a woman that had been coming to the center for a year and she was being moved out of her apartment because she was in a 2-bedroom, she couldn't afford it. I got her on Section 8 and still she wasn't connecting all the dots. She had to go live with her daughter for a little while and trying to get her into another apartment was really hard because she's just used to not having a place, used to being homeless. And she said, Amy, you cared more about that apartment than I did. I'm like, yeah, I live in there. And she's so happy now. She's so happy. Oh my gosh, like trying to get everything to click
Right.
and like just working with people that have that, you know, that history is, you know, you have to come at it with a different angle. And yeah, I did way more work than I should have on that, but she's happy.
Right.
We're happy.
We're happy that she's happy.
Right. And you know, she talks about Section 8, like the hotel to housing clients, and there's some veterans that got bumped up to the top of the list. But the Section 8 wait list is what, 20 years?
Yeah, it's closed. It
It's
doesn't
closed.
open.
Like
You can't get it.
Yeah, I mean,
It is
people die waiting
It's
to get
not
affordable
really
housing. It's insane. So that's another federal issue that is discussed a lot and presented to, like, Aging Advocacy Day. You know, affordable housing, caregivers, support staff. So those issues are being addressed at a higher level, but it's tough. It's tough out there right now. And you know, for those of us that work in it and see the cost savings, the way that we can prevent some of this from happening, you know, it's a long-term cost savings, but it really does work. And to get them to understand that, like invest now, you know, because you go to the nursing home, $10,000 a month. I mean, and that's what the federal government is choosing to pay. Like that's crazy, you know. Invest here at the local level. So, and we're lucky. Fitchburg is very supportive. So, yeah.
Any questions?
Very
Well, thank you for
Yeah,
everything
thank
you
you.
do. Yeah.
Thank you. You're welcome to stay for the rest. Super late.
Stuff to do.
Yeah, I know. Thank you, guys.
Thank you. So next we'll look at the 2024 budget.
So I just put that in there. It's not very different than what I had showed you guys before. What I did, let's see. Well, let me look at Paul's email here. Paul had trouble joining. His email. Paul's trying to Zoom.
Oh,
Actually, I can do. I'll just pull this up so you guys can see some of the budget here. Okay. So this is our current staffing. Come on. It's out of the way. Okay. Let's see. Okay. So this is kind of what we have now. This is something that we have to do in terms of talk about kind of our major responsibilities, and that's kind of what I just standardly put in. This is some of the stats that are in the budget request that every department has to put in something. You know, they decide what interesting stats, what are, you know, some of your more critical programs, and so these are the ones that I choose to show. We really struggle with data tracking for programs and participants because we have so many people that just come in the doors, have coffee, you know, just come in for, you know, just fun programs where we don't, we walk that line of not trying to gather all this information just because you came in for a cup of coffee. So there's a large group of people that we're not tracking. So the non-registered programs, we still try to do a paper sign-in, you know, and put that data in there. But oftentimes, again, like, it just gets hard to track everybody. We're really, you know, we're doing a lot of registered programs that you have to register for, so we can dump that in there. But go ahead.
Question on the previous slide.
Oh, sure.
The current staffing, did you share with us last meeting that you were looking at submitting a
Yeah.
halftime?
Yeah, I'll show you that in
We'll
one
come to
second.
that later?
Yeah,
Okay.
yeah.
Never mind.
Oh, no worries. So anyway, Dave and I are always talking about a better way that we can track people. And I'm thinking, we just need a clicker on that door.
That's what I was wondering.
We just need a clicker because from 8 to 4, pretty much 99% of the people coming through the doors are ours. And it really gives you that sense of activity, you know, because again, like Amy, I mean, we can have 3 or 4 people picking up durable medical equipment and whomever's available. If the social workers aren't available, it's one of us doing it, and it's taking a good 15 minutes. And maybe they go in the case management database, but they're not in the program database. And so trying to pull all of this activity into one burst, I'm thinking it's just a ticker.
You could have an electronic sign, welcome to the senior center every time.
Yeah. So anyway, so I don't feel like that's, you know, you can look at the registered programs, the case management folks, you know, I don't have
you know,
enough. Go ahead.
the photoelectric eye, when people go in or out, that's good data. It's not, doesn't say what exactly they're doing there.
Right.
But it's another piece of information. You know,
Right.
you can look at all the registered programs and
Right.
say, look, here we have actual registered people.
Right.
But in actuality, there's 3 times as many people
Yeah.
that actually come in and out.
Right, because, you know, registration is not I mean, for programs, for some of the programs, we ask you to register, but then we don't really have a membership per se, but we have this, just register with us so we know you count. But again, that's only as good as the people, and that's the same for any computer program too. If we had a little fob and we said, we need you to scan this when you come in, it's only as good as the people that are gonna scan it. So you're never gonna be super accurate, but I think that ticker is where it's at.
They're
So,
pretty cheap too, like a little trail thing.
exactly, yeah, so. So then we have to put kind of what our budget changes are, and I briefly talked about this. I did put in the money for transportation. This other stuff isn't super exciting about signage. Public information, we increased it by 2,100 because we're making so many more newsletters with all the new apartments in here in town, and so our costs are going up. And also Sprint Print, sold their company, and Sprint Print in the senior center had a wonderful relationship for 30 years, and they gave us a really nice discount that, wasn't carried through, and I understand with the new owners, and so we're seeing a little bit of an increase as well. But Dave does a good job of collecting revenue from the advertisers in the newsletter. We try to strike a balance so we don't have advertisers everywhere in there. But businesses are kind of coming to us now, which is nice. I'm increasing the nutrition program a little bit as I think I don't know, Jim, 40 home delivered meals on average now, 35 to 45. Yeah, so that's a little bit more. And the county gives us money for nutrition.
51 Tuesday.
Is that right?
Yeah.
50?
51.
So lots. You're delivering a lot, and you. Program expenses, I'm increasing that as well because we want to start doing more outreach activities and just some little giveaway things and ice cream social kind of stuff and things to the friends. They cover a lot of that too. And then also a little bit more in the volunteer budget so we can do better recognition as costs to do anything go up. So that's the budget that you guys saw last time. Nothing new and exciting. You can go through that if you want the detailed. And then the personnel requests. What I put in was, I actually did a few. And then I'm going to go into some more detail too about the organizational study, and I'll make it quick. But I put in for an activity director, an activity assistant, because what we're finding is between Dave and I, trying to do all the programs. I'm at a bazillion meetings. He's doing registry. He's doing a lot of computer work. It takes a lot of time on Google Docs to make all those registrations and change them and watch them and do the newsletter and attend to each present. Like yesterday, we were flying around, all of us. We had 3 things going on at once, and he's setting up, and somebody needed an HDMI cord, and he had to set up upstairs. He had to set up the Swan Creek, and then he had to set up the Cyan room. A 25-hour activity assistant would be somebody that can assist him, that can take over some of that stuff, and then can program around the lunchtime. Because why don't you have more going on at lunch? Well, what staff is going to sit there? You have to have some staff engaged to do, all right, let's do a game, let's do chess, let's do something fun, but we don't have a dedicated staff that can do that. And then some of these bigger events, National Senior Center Month, Veterans Day, Older Americans Month, Juneteenth, they take a ton of time. And so as my position gets busier and he gets busier, I felt like that might be a really nice addition, is to have someone with lots of energy that can do the people that are there every day that come on the bus, that we try to engage more. And Tuesdays is a prime, there's just nothing going on, right? From when they get there, there's no exercise. Like the other days, there's exercise. To implement something where we can have a person engage them, and then take over some of these other day-to-day things that, if Dave's not there and I have to do it all, and I can depend on staff. But I'm pulling the social workers in more. Can you set up here? Can you take down the ping pong tables? Can you do this? That's not their job, and for a while it's okay. But as we grow, that's not going to be okay. So I put that in. And I'm pretty used to, it takes a while to get new staff, so it just starts people thinking. And then I did put in again, last year I put in for a 25-hour-a-week nutrition coordinator, which would then make the volunteer coordinator full-time. Because I think that we could do more with more volunteers, but Mandy's in the kitchen a lot, and so we could pay someone a little bit less to just manage that kitchen, to be in there, to help with meals when a driver cancels, to get a driver to do all the county reports that she has to do, and that would just be their job. Again, I'm always dreaming. They say, give me what you want, give me what you think you might need, and then I put in the 20-hour-a-week bilingual case manager. Actually, and the activity assistant would be bilingual, because now we have, like today, we'll have 4 or 5 or 6 Hispanic folks that Bill's calling bilingual bingo today, because we moved bingo to bilingual now. So every Thursday, it's called in English and Spanish, and that's really exciting. So we have 3 callers now. So that is what I put in, and then I'm just going to briefly talk about the organizational study that came out publicly yesterday. And it was presented to personnel, and it will be on the city website soon. I will watch and let you guys know where you can access that. But I can tell you that for our department, what was recommended was that senior center and recreation merge into community and leisure services and become one department.
Say that again?
There was a recommendation that the senior center and the community center and the rec department, all in that building, merge into one department called community and leisure services. And it is because looking at the efficiencies, the way to streamline, that we're all in the same building, that we have 3 different budgets, that we have, a rec director, we have a parks director, we have a maintenance budget, we have a community center budget. There's just no cohesiveness. We're all using the same rooms, but we're using sometimes different programs. We have 2 entrances that we don't manage very well. And so that's what was recommended. And I'm not sure where it will go from here. It sounds like, I didn't watch the meeting last night, what the city's gonna do with these recommendations, because again, they're just recommendations.
Are you agreeing with that
Yeah.
recommendation?
How do you feel about that?
Personal view of that?
Personally, I am in support of that. And I wouldn't say that 20 years ago, but as watching how busy everybody is, watching a merger of ages of like 55 to 65, and they don't know where they fit, looking at potential opportunities to say there's no wrong door. If you come up here to register for the senior center or a kids program, or you come down there, there's no wrong door. So I would be in support of that.
Would encourage more intergenerational.
It would encourage more
Yeah.
intergenerational. I think there's a lot of opportunities to be had by us all working together under one roof with some, guidance that we all, are on the same path and going the same way, and utilizing staff in different ways that could benefit both departments.
Is the decision pending on this, or you don't know?
I don't
They
know.
just
I think what's
discussed it.
gonna happen now is that, when I put in all my budget proposal for personnel, I saw that, but I don't know if that's gonna happen. I don't know what's gonna happen. And so I just told the city, I'm just gonna move forward as if I'm my own department. But it looks as though the city is gonna throw all these new positions. So this is a new position they would create at the senior, it would be called a Community and Leisure Services Director position to oversee everything. They would take the current Parks and Recreation Director, Scott, and move him under Public Works. Because years ago, when we went through the organizational study, and it had to be 15 years ago, they recommended the same, to merge our departments. And they also recommended to take Parks and put it under Public Works. So what happened at that time is they took Parks maintenance and they put it under Public Works. So now they're saying, well, this is silly, let's just reclassify the Parks and Rec Director to Parks Manager, and then he just does all parks related, and then that becomes Community Services, Leisure Services. So I think that, and again, there's lots of positions being, and there's HR positions, there's a communication director position, there's all kind of, and again, it's their suggestion. The final approval will come from council and the mayor, and they're gonna have to look at all of these positions that were proposed, and I think there's 10 full-time. And then they're gonna look at all of the departments, because like myself, that doesn't mean what I put in lines up with the org study. And then they're gonna have to flush all this out, and I suspect it'll be slotted. Maybe they'll say, this looks like the direction we wanna go. let's move, we'll add this person at this year, maybe 2 here, I mean, you're talking police, fire, it's a big study that impacts all the departments, and so that's just our department, how that would impact us if indeed that did happen. So, a lot to digest, and again, I'll let you know when it's posted, and you guys, it's open to the public now, or if you wanna go online through Fact TV, you can watch Personnel, it was Baker Tilly that did the study, and they presented the study to Personnel last night. And I think you can find that meeting and watch it on the computer if you want more details about that study. So there you go. Let that sink
I
in.
probably talk too much, but what it sounds like, and I'm not sure I fully understand even now all the stuff you do and stuff, but I was hearing the social workers and you talk about needs at a lower level. What this study is talking about, in other words, social worker needs or volunteer needs, or I can't remember what all you were talking about, and now I'm hearing there's gonna be a sort of mid-level position created. Somehow it just doesn't seem to be addressing what I'm hearing to be your needs.
Right,
You have staffing needs at a lower level than
then at a higher level.
somebody to oversee the whole building.
Yeah, I understand your question. Yeah, I don't know how it's all gonna mesh. I think there is an opportunity to utilize more staff if there was a merge in departments and better operate that building. I think we could do more night things, we could do that kind of stuff. The staffing for the social workers, again, that for sure, but I feel like, and they would agree, we don't have a wait list. 2025 is where I'd want that 3 full-time positions, so that I did slot in. I would strongly believe we would need a full-time volunteer coordinator if that was merged, because I believe in the power of volunteers, as you all know, and what could we do with more volunteers and run more programs. But your question is good,
And we're not real familiar with the rec department staffing.
Correct,
And
right.
where there might be some overlap or some shared
Right.
skills that
Right.
maybe we would be able to do more with that existing once you melt those.
Right,
teams.
so if you've got staff up here, maybe the senior center staff isn't running to set up tables and chairs all the time, because we're all doing it together now. The focus is all on just doing better service for whomever is coming through the doors, whether it's kids or adults. But certainly there would still be, I think, a specialty, I don't know.
The idea of more multi-intergenerational, it really starts to blur the lines of the perceptions around senior center. It starts to remove some of that, and if we could get more people in every door that are 50 years old.
There's a huge age population that doesn't fit.
Anywhere,
Yeah.
right?
Yeah.
And we get that sometimes, where I'm still working, I need night programs, and there's Zumba up there, there's a workout class, and I think that, and again, like that's not, it's weird because who serves them? I'm kind of 60 and older,
Yeah.
And those guys are more younger,
Yeah.
and it's just kind of the nature of our titles and in our lanes that we're in. But I do think there's a gap that has a lot of potential to serve as well as serve back,
Yes. Yeah.
And there's already a lot of overlap with recreation, and you have exercise programs.
Right.
And many of the programs kind of would blend well with what recreation is doing.
Right.
And it would be a true community center and not just a senior center.
Yeah.
And I think that would balance the workload a little bit if you had more support in programming, for example.
Well, restructuring positions can
take a
really
while.
have a lot of impact
Yeah.
if they're really looked at and rethought.
Yeah, I don't disagree. And again, this came out in the first organizational study like 15 or 20 years ago, and I was like, no way.
Yeah, I remember
No way. I hope that doesn't happen. And I don't think that anymore because I see the multi-purpose of that building and having one vision And I think when you have one vision, you are more cost effective. Your customer service is better. You're more welcoming, you don't have to go upstairs to get help or go downstairs or I don't know where your meeting is and that kind of stuff. You just have better service, but I don't know. And I don't know where this will be taken. Again, I don't think I don't know if even all the council people saw the org study yesterday, so.
That was the first conversation about it?
I knew about it.
Yeah, but I mean, public.
Right, but yes, it just became public. City staff got the org study last week, so there's been some time to digest it.
But it was an extensive study, it didn't,
I think
So,
it started
I think-
in January.
Yeah.
so they've got a good basis for
They
making.
did, they met with every single employee.
Baker Tilly does a
that
good
could-
job.
What's that?
Baker Tilly does a good job.
Yeah, so they did, try to capture everybody's thoughts.
Mhm.
So we'll see. I will keep you posted as the budget process goes. So, okay, all right, that's a lot. And that just came out, yeah, anyway. Okay, so guidelines. You guys, I gave these to you earlier. If anybody needs a copy, I have a copy here too. So we talked a lot about the administrative guidelines, which feels like a weird title, but it's tied into giving us some consistency, how we select programs to make sure we're balanced in all areas. And so I did a little bit more research and I found that the one in the chart down here that I pulled some information from. The first one with the bullet points was from the National Council on Aging, and it kind of went in line with accreditation, make sure you have programs that do these things. And then when I saw this other chart, I kind of like that better. So, again, as some of our other policies, we don't have to do this today. I want this to be a nice, thorough discussion. And I think when we're done, we'll have a really nice document that we can go, okay, we are heavy on this area, we don't have enough of this, are we really meeting everybody's needs? And so just looking for some input from you guys about this document. Anybody?
And the chart in the center, who put that, or where did we?
I got that from some other senior center somewhere. Some kind of, I can't remember where I pulled it. I'm really good at stealing other people's stuff.
It's getting smaller and smaller.
I know, I was trying to get the whole, it's getting smaller and smaller. That's not me.
I thought it was a good way to create a framework around choosing and scheduling programs.
Jim here.
And gives you, and I think when you have a framework like that, it also generates new ideas. It helps you, when you see it like, oh, are we doing enough in this area? And I thought they were similar but the same. I sort of preferred the first one since it was more general. I thought you kind of get locked into, well, what's an art and what's a craft and
What's a hobby?
and what's social recreation versus recreation, I think these are things that could just be thrown out as ideas. It's a good way to generate discussion, but I prefer the top one for what it's worth.
That's helpful.
And I see it, for me, it's different. I think I like the breaking out, but I don't know that it would be advertised. It was more in deciding them for balance, because like arts and crafts, there is a difference. And because creative work versus doing a craft, and do we have just crafts all the time? I mean, just in decision making, but maybe not in advertising it.
Yeah, I think it could be more of an internal discussion, but I kind of agree with you now.
Yeah.
And I did get kind of down in the weeds with like, well, right, what's a hobby, what's a craft,
More for just checking balance,
Right.
or
exactly,
that
right.
kind of a
And what's an
decision
art? Because
making.
painting can be a hobby or a craft or an art. You know what I mean?
Yeah, 'cause it might
could all
be-
under
yeah.
one. But where would that, if you look at the top there, would that be like, mental stimulation? Would it be socialization? You know what I mean? Where would an art and craft go in that bullet point up top?
Because that's your really your mission, that
Correct.
these areas at the top fulfill your mission.
This is more a bean counter.
Yeah.
Right,
Well, on the last list, that operational kind of component, do you have the place, the
Yeah.
time, the
Yeah.
staff?
right, that seems really important because I think that that's, that's some things we now have to consider.
Right.
Do we have staff to manage that? Do we have the IT support we need? So if I were going to recreate a document, would it be enough to just look at those bullet points on top and bottom and kind of utilize those as our guide? And does it administrative guidelines really fit the description of what I'm doing? Or is that just me?
Do you have other administrative guidelines other than this one? I mean, that you could call and like say, these are our administrative guidelines.
No, I don't think so. I don't know what
Like,
that
where
would.
would this be housed? Is this a part?
Yeah, what is it in?
It's in my binder. I don't
Under
know.
Administrative.
I have,
Do you have any programming guidelines?
that's what this is, right?
Right.
That's why I was like, maybe it's not administrative, maybe it's programming. Because now we have a programming policy,
Right.
and that this sort of is,
You could just have it be a checklist attached to your programming policy.
yeah, like a
A
checklist
checklist for
maybe.
determining what programs to sponsor.
Mhm.
And if you select a program to sponsor or to offer, it would have to support your mission,
Mhm.
and it would have to meet these physical demands.
Mhm.
And then, this checklist could just be examples of programs that are offered or have been offered, or
Mhm.
categories of programs or something. You wouldn't have to get too specific, but for someone using the checklist,
Mhm.
they would be able to apply it through that lens.
Do you have a nutrition policy, as an example?
Through Dane County, we have a whole
Do you have
statute.
guidelines for deciding the nutrition policy?
The county provides us, there's like a meal assessment.
But what I'm
Oh,
saying is, I mean, like usually
Yeah.
with policies and guidelines, you have your policies, these are voted on, have to bring it to the committee at large. Your guidelines only help you decide, can be changed, can be
Sure.
altered. They're not as formal.
Yeah, so that's what this would be doing.
Yeah, so normally guidelines go with a policy.
Yeah, that makes
Yeah.
sense, so we could attach this, like
Implementation
you said.
Yeah, they're
Yeah.
flexible.
Yeah, and something to use to assess and
Right.
implement the policy.
Yeah, and when you said house it, I mean, that's where I was thinking it would be housed in a policy binder that had the
Yeah.
program policy with it, and behind there
Is the
would
guideline.
be the guidelines.
Yeah.
So, okay, all right, and then so like that paragraph right there, or whatever you're saying, does that sort of capture what this is trying to do? Maybe we can have better words.
I think it's fine the way you've got it. I remember when we first talked about this, it was focused on what kinds of programming are we going to promote and or allow. I think we've got a framework here that we can, I don't want to say restrict, but we can justify our decisions about whether or not certain kinds of programming would be appropriate for the senior center. And I think that this does it.
It just gives us kind of those bumpers to be like,
Yeah.
well, or, boy, we have, too much of this and not enough of that. We should probably look for something that fills that slot, that we don't have a balance in. Yeah.
I think I might add that somewhere make reference that the programs maybe just tack on to the end of the sentence, and it's supporting our made to balance program offerings in as many areas as possible in support of the senior center mission and vision. I think you want to tie it back to that as kind of an anchor.
That's a good idea.
or some such language, it doesn't have to be that.
Yeah, but I like pulling it out for that. Okay.
Good start.
Yeah, I think it's a good start. Okay, so I'll clean it up a little bit and bring it back next month. But should we call it program guidelines or program checklist or administrative program guidelines?
Program guidelines. I think that's really what it is. It's not administrative.
Yeah.
You don't need that word.
Well, it is administrative, it's a decision-making tool.
Right.
About
Administrative.
programs.
Administrative program guidelines?
I go for administrative.
You like administrative guidelines?
This is,
For
It
programs?
distinguishes it from the policy.
yeah, this is what
Administrative
you do
guidelines for
as an
programs.
administrator.
I like simple, I think program guidelines is sufficient, but.
I'm gonna put it all in there.
It's
It's only been talking that's gonna go behind the policy.
Programming administrative.
Administrative program guidelines.
We'll sleep on it.
Yeah, all right, sleep on it, but I'm putting it all in there next time.
Okay.
Okay, all right, okay, so I think that is all I have for this, thank you.
Okay, let's move on to the senior center friends then. Bill?
All right, just so you know, the Friends decided that we're gonna send a different person every month to sit here with you, just for the sake of educating members of the Friends about what you're doing. So I drew the short straw this week.
The lucky straw?
So here I am. Just a few things, I guess these are the sort of things you're interested in. Our minutes from our last meeting this week showed monthly payments last month of a little over $1,000. I don't know if you need to know all the details, but there's special needs chunk is most of that. These are including an Uber ride to a medical appointment, purchase of a phone apparently from Dorn Hardware, something to Guardian Medical, I'm not sure what that was, a meal program to purchase fresh fruit and vegetables. John Melby installed 2 grab bars for somebody, and we bought a bed frame and box springs for somebody. So those are the kind of things that we provided, not huge funds for, but I'm sure they're very much needed for a few people. So that was about $1,000 that we laid out for that kind of thing. We had some more discussion about the National Senior Center Month celebration, September 15th. And we're gonna attempt to obtain a liquor permit so we can provide beer.
And wine?
And wine, I'm not sure if, I don't think so.
I think it's a different permit.
Oh, really?
Yeah, I think that came up and,
I always thought it was the same policy.
Beer and wine.
I don't know.
I don't think.
And we also approved $1,000 for what's called Mandy's Fresh Fruit Program. I guess Mandy buys fresh fruit to
Oh my
put
gosh,
into the meals.
it's been really lovely,
So that's
Salads,
obviously,
they look so pretty.
didn't they? Yeah.
so that's a small thing. And we also had a little discussion, I made a report, I'm on the Transportation and Transit Commission. And so I did want to mention, elaborate a little bit on this. As you I'm sure well know, Jill has been on a campaign for who knows how long
20 years.
to get better transportation opportunities for people to come to the senior center. And last year, or some time ago, the city council approved, there are 2 items that the city is considering. One is within the capital improvement plan, there is money, there's a spot for about, I don't know how much to buy a vehicle,
Oh, yeah.
probably now in 2025, I'm not sure, and which could be employed to bring people to the senior center as needed. It's very unclear exactly how that would be used. And so I think mostly through the intervention of Gabriella on the city council, the council approved, I think it's up to now $25,000 for a study to look into providing better transportation basically to the civic campus here, not just the senior center, but focusing on, is there a way to have shuttle service to pick people up at their house in the hours when they are not currently provided? And is there a way to connect the metro transit system? You can get to the corner of Fish Hatchery and PD, but you can hardly get from there to here without going through downtown or something. I mean, it's
Yeah, you can, it's only a commuter route, so in the morning or in the late
so
afternoon.
it's a kind of a glaring gap, and there's a lot of need to get to the civic campus, not just for seniors, but
Right.
for other stuff, library, legal court services, and other things, you know, come to a city hall council meeting or whatever, that's unmet. So our idea that the Transportation and Transit Commission has advocated and supported is to have funding for a study, $25,000 to look into how to do these things, how to get is there a way at reasonable cost to get a shuttle service using presumably the vehicle that's in the capital improvement plan, and to connect this gap in the public transit network, which is very surprisingly expensive. We went through that whole discussion when they were redesigning the metro system. It is not a cheap deal, and one of the problems is that, well, anyways, it's very expensive to get a bus to go back and forth. So that's still in the work. We're tracking, the Transportation and Transit Commission is tracking council activity towards that study, and we're interested in how that will be fleshed out and what actually will be studied and what will be the results and so on. So that's a central interest for the Transportation and Transit Commission. Nominations, we approved a new board member, Rita Thomas, to be on the Friends of the Senior Center Board, but we have more vacancies, so if you all know people who would be interested, we rotate on and off, so I'm just finishing my second term on the board.
Yeah,
and,
3 years.
3-year terms. So we need, I've found a very interesting thing to do and instructive, and I'd encourage anybody to give it a try. It's not very heavy lifting, and you meet a few nice people. One of the major fundraisers the Friends has is a travel program cooperative with Mayflower Travel, where we recruit people to go on their tours and we get a little cut, and Friends makes a fair amount of money off that. We have 27 bookings for a Rhine River cruise, 10 to go to New England, that's this year, 2023, and there are already 31 bookings for 2024 tours, so quite a few people take advantage of these. Everything I've heard is they're very nice tours, and we are happy to be involved in that. And the last thing I would mention is advertising and marketing. The Fitchburg Star is going to do an article about our travel program, so that'll be a promotion of that.
Didn't Kathy talk to him, Jim? Yeah, nice.
So that's my report from the Friends.
Okay, any questions for Bill? Okay, thanks so much. Director's report.
Okay, let me get brief, close that. Okay, so if you look out today, they're pouring the concrete for the patio, which is crazy, like it's happening.
We're pouring the base.
They're pouring they call it a ribbon, so on the base, yeah. So I don't know the gray concrete, but the ribbon that's gonna be colored is being poured today.
Oh,
The engraved pavers hopefully will be here within a week or so, and then I got confirmation that they're delivering the shade structure on the 5th of September. And so all will be done. Initially, I was gonna do the ribbon cutting for the patio on the same day as the National Senior Center Month celebration, which is the 15th, and it's a Friday. But after talking to the chamber, they're not able to come on a Friday afternoon, and a lot of businesses, they recommended I really do it separately. So we're gonna do the ribbon cutting, depending on securing the mayor and the chamber, probably either the 11th or 12th, like that Monday or Tuesday around noon. And then we'll do our National Senior Center Month celebration on the 15th. So I am gonna separate them out. So anyway, so that's very exciting that is happening.
Was it September?
September 15th will be the National Senior Center Month celebration, but the 11th or the 12th will be the ribbon cutting for the patio. I'm really happy the shade structure will be here in time.
We were gonna have our men's group meeting on the patio,
Yeah.
but it's not gonna be done.
Which day? You're early on.
The 12th.
It will be done.
Will be the ribbon cutting.
You will be the first user group. You're right. It'll be, yeah. Anyway, it's very exciting.
We'll see.
We have about 10 pavers left to sell, but we've had just wonderful donors, and
I have
so,
a question on those
Yeah.
10.
yeah.
If you have, say, 6 blank ones left that nobody has requested,
Yeah.
do they put the pavers down anyway?
Yeah.
And then somebody else gets some money, so they pull it up and engrave it and then put it back down?
So what happened is I bought an extra 10 pavers that are housed at the brick company. And so if somebody calls in another month or two and says, I want to do one, which I anticipate they'll all fill up, I just call the brick company, they engrave it, they ship it, and then we'll pull out the blank one and put theirs in.
Put the new one in?
Yeah.
Oh, okay.
So we're just determining what kind of sand to put. They wanted to use a really some kind of sand that's really almost ends up like concrete in the ones that are already engraved, and then a different kind of sand, because we'll be pulling those up. Because again, I think it's a nice way that people will want to recognize people. I think that what I failed to do and had, hindsight, I just panicked, but I think I wish, and there still might be an opportunity for people to leave a legacy at a lesser price. I'm not gonna look up there. Anyway, so, somebody asked like, oh, do you have a $500 option or a $100 option? So, once the patio is built, maybe there will be another opportunity that we can create some other smaller ways that people can leave a legacy for a lesser value.
So does that go into your legacy? You have something called the legacy fund?
Yeah,
Is that where the extra money will go?
yeah, and come from as well, yeah, from that fund. So anyway, that's the patio, and it's just, I tell you, every time I walk up, I can't believe it's happening. Because it's really been 2.5 years, almost 3 years, when I first started talking about it. But anyway, so Mandy's starting to work with the UW Mortgage Center, who has volunteers that hopefully will have Spanish-speaking volunteers to do other activities this fall. They're also going to do a work day and maybe do some painting for us, so details are still in the works about that. Senior Center will have a table, National Night Out, or Community Night Out, is at McKee Farms Park next Wednesday from 5 to 8. So a big community event, all are invited. We'll have a table down there just distributing information about the Senior Center. And then also we're gonna participate in Luna's Block Party, which is over by Allied Drive and the Boys and Girls Club. It's on a Saturday, so Susie and Katie are gonna man a table, and hopefully we'll connect with a different population that we're not serving as well over in those areas, kind of West Verona Road, Allied Drive, so just a little bit more outreach there. And then we're thinking about accreditation, we're kind of due, and looking at developing some committees for accreditation. I think probably you've gone through it with me and Barb, and kind of breaking down that accreditation into different categories, and having work groups, and then paralleling the state accreditation. So there's national accreditation, but now it's free.
Oh, it is?
Uh-huh.
Oh,
I think nobody was doing it because it was so expensive. So now they're just giving everybody the documents to use, and there is no national accreditation anymore. They won't come out and accredit you, but we can use everything to help us even be better, because there was some good stuff in there. And then we're going to also include in this process, the inclusion toolkit that I have that is really good too. And so anyway, I'm just starting to think, because it's about a 6-month process, and we won't have to be reaccredited until next September, but it's a good time to start and really just take our time. So I'll be bringing that to the Friends, to the Plan for Growth Committee, and to you guys to start to develop some committees and work on that. So that's on my to-do agenda. And other than that, September's programs are full up, and so it's always a busy month in September, and things are going pretty well down there, so that's all I got,
Okay.
which is plenty.
Is all of the water damage been addressed?
Yeah, except they were gonna replace the carpet in Susie's office, but we have not heard back from them. And so it's kind of at the city's level now, but the social workers are everything is back and running, and it's very nice in there, so yeah.
Okay,
That's it.
any questions for Jill? Okay, our next meeting will be the 14th of September, the day before.
Oh, right.
Oh, wow. It'll be a busy week.
Yeah.
Okay, if there's nothing else, do I hear a motion for adjournment?
I so moved.
Second.
Okay,
All right.
all in favor?
Aye.
Okay,
Thank
opposed?
you all. There's
Adjourn.
a lot to digest today.
Thanks for your input.
Yeah, thanks, Bill.
Thanks for your input on
They're
that.
there now.
Well, I felt like I was kind of not my place, but I
That's fine. No problem.
Thank you.